Dr. David Priest. He's a senior VP for Novant Health. And I'm not sure he's on yet, but joining us will be, excuse me, Dr. Gary Little is the Chief Medical Officer for Atrium Health. I have a few opening remarks, and then we'll be opening it up for questions from the group. Just as an update, our metrics continue to trend in the right direction here in Mecklenburg County. Our positivity rate is hanging around 5.6%. Our case count continues to drop, as well as our hospitalizations. We're seeing improvements there as well. I'm pleased to announce that our outbreaks in our long-term care facilities and other congregate living sites is down to 39. That's almost half of what it was back in the middle of January, so significant improvement there. I do want to also remind people about issues that we are facing that we need to pay attention to. One is the increasing number of variants that may be available in our community. We know they're not available, but are present in our community, and we know that those variants are present in the United States, and the likelihood that we may be seeing some of that activity in our community increases. We're also seeing increased activity in our community based on the governor's order and the lessening of some of the restrictions, which is a good thing, but we need to be cautious. We need to continue to use common sense on where we go, when we go, how we go in our community, so that these numbers can continue to decrease for us. Unfortunately, we are still at about the same place we were at our spike in mid-July. So although our numbers have come down significantly, we still have a lot of virus in our community and need to be vigilant in our efforts to make sure we're continuing to prevent the spread of this virus. So wearing your mask, socially distancing, not engaging in activities that put you at risk of exposure unless they're necessary. So limiting, again, your activity outside your home. But the other thing that we have going for us right now are our vaccines. With the announcement over the weekend of the approval of J&J vaccine, the one-shot vaccine is great news for us. Now we have 3 vaccines that we can depend on. We will be receiving additional vaccine in our community this week that we will use over the next week and a half for the priority groups that we have. The health department is receiving 11,000 doses of J&J, as well as an additional 5,850 doses of Pfizer. Those doses were requested from the state as a joint effort between Atrium, Novant, and the health department to work on getting those individuals who are priority right now for vaccinated as quickly as possible. So those vaccines will be shared with both of our healthcare systems, and we will work on getting those vaccines out as quickly as possible. In addition to that, I think we had a press release that went out just a few minutes ago. Our department, the health department, is announcing additional appointments being made available March 10th through the 31st. Individuals in groups 1 through 3 who are eligible at this point in time are going to be able to go online or through our hotline for those appointments beginning March 4th. So that is good news for us as well. So I'm going to stop there. J&J, I believe, and we all believe, and you're going to hear this from the experts in just a minute, is a very safe and effective vaccine, as well as the Pfizer and the Moderna, and we're excited about having additional vaccine available in Mecklenburg County. So I'm going to stop there and allow for questions at this point. And it appears that Dr. Little is having some computer issues, so hopefully I'll be able to join us in just a few minutes.
Okay, first question today is Claire Donnelly, WFAE.
Hi, I wondered if you have any updated timeline, I guess this is for either Dr. Sullivan or Gibby Harris, of when you expect the J&J vaccines to arrive, when people can start getting vaccinated with that, and how many appointments are you opening up in this next round?
I'll let Dr. Sullivan answer those questions.
Yeah, so we don't have the exact date that the Johnson & Johnson will arrive. We do believe that it will arrive sometime this week, but we're waiting to receive official shipping notice and time frame from the state about that. And in terms of, as Gibby mentioned, we are going to be collaborating with both Novant and Atrium to get those doses out into the community over the next several days. In terms of opening up additional appointments at our Bojangles Coliseum, again, we will be opening a limited number, likely somewhere around 400 appointments a day, and then continuing to open appointments as vaccines become available.
Next question is Brett Jensen, WBT Radio.
Thanks for doing this, guys. I'm curious, I think this will fall with Dr. Priest. It's expected today that Governor Cooper is going to open up more Group 3 today, earlier than the scheduled March 10th. That's some of the reports coming out of Raleigh. So we know that teachers are having teacher-only vaccine events where the rest of the public, 65 and older for Groups 1 and 2, are not made available or not allowed to do it. Do you think that there should be events maybe just for restaurant workers or just the police officers where the other groups are excluded as well? Or do you think this is just a unique thing to teachers?
Yeah, and I'm happy to address that. I think from our standpoint, we follow the groups very closely. We look at the patients and individuals that are in phase that the state is recommending. But it all comes down to vaccine allotment and volume, right? So the reason we have all these issues is we don't quite have all the vaccine we want or need. And so we have to try to prioritize in the best way we can, given the guidance we have from our local public health officials on this call and the state and our federal guidance. So we understand their competing priorities and their frustrations among groups in the community. And the only way that's going to be totally alleviated is to have more vaccine. The exciting part is we have a third vaccine coming this week. And I think as we get into April, allotment on all 3 of the vaccines is just going to go higher and higher and higher. That'll alleviate some of the bottlenecks that occur because of this. When I was in medical school and the surgeon asked me to cut the sutures in a case, they were either too short or too long. And this is the same case here. It's so hard to get this exactly right. There's not going to be perfection in this kind of rollout simply because of the limitations, the amount of vaccine we have. So I think all of the people in the groups you mentioned are well deserving of vaccine, need vaccine to protect themselves and our community. And we'll be working in any way we can to collaborate with the county and the state to get events for whoever is eligible as we get into those groups. But as of right now, we don't have enough vaccine to accommodate every person, certainly in Group 3.
Next question, Hannah Smoot, Charlotte Observer.
Hey there, Dr. Sullivan. Could you maybe talk a little bit about how important it's going to be to get this one-shot vaccine into the community? And then what would you say to people who are maybe, ranking their vaccine preference based on this efficacy rate? What would you say to those people?
Yeah, thank you for that question. And I think I'll just follow up on what Dr. Priest just said, that our goal is to get as many people vaccinated as possible. And again, to follow up on what Gibby said, we are incredibly excited that we now have 3 very safe and effective vaccines. So at this moment, it is important for us to get as much vaccine in the community as possible. That includes the Pfizer vaccine, that includes the Moderna vaccine, and that includes the Johnson & Johnson vaccine. And our advice to everybody at this time continues to be, if you are eligible for a vaccine, please make an appointment for a vaccine and make an appointment for the vaccine that is available. I think, again, as we get further down the road and potentially even more vaccines become available, kind of having conversations about different vaccines. But right now, we know that the 3 vaccines are safe and effective, and we want to get them all out as quickly and equitably as possible.
Next question is Tony Messia, Charlotte Ledger.
Good morning. Thank you for holding this and for taking my question. Just following up on Brett's question. This is for Gibby Harris. As it relates to the governor's press conference this afternoon, he's expected to accelerate some of these timelines. What have you heard about that from the governor's office? And if he does move up Group 3 by a week starting tomorrow, would Mecklenburg County be able to accelerate its timeline as far as making vaccine available to frontline essential workers?
That's a great question. We have had conversations with the state about this. The challenge with the governor making decisions about when to open things up is that he has to look at the whole state. So what's happening in Mecklenburg is not necessarily happening in other counties. There are counties who have been able, because they've got much smaller numbers than we have and have gotten relatively more vaccine than we have, that they've been able to get through groups faster than we have, and the state doesn't want to hold them back. And that's my understanding as to why they're moving forward with the possibility of opening up the rest of Group 3. But the guidance that I'm getting from the state as well is that we need to make a decision here in Mecklenburg County about who we're vaccinating based on the vaccine that we've had available and the groups that we're trying to move through, so that we're not leaving people behind who are eligible for vaccine. So that being said, I will say that we've gotten additional vaccine in, or we're getting it in this week. The intent behind that original initial vaccine and the request to the state was to make sure that we had enough vaccine to get our educators, our childcare workers, as well as our school staff vaccinated as quickly as possible. So all of the planning that has gone into how we're going to move that vaccine out has been focused on those populations. That being said, we are also having lots of conversations with both of our healthcare systems about the process for getting vaccine out to the larger Group 3, and there's lots of plans in place over the next month or so as we get more vaccine to make sure that that's available to those groups as well. So as you know, we are opening appointments through the health department starting, the appointments are available starting March 10th. We're making them on the 4th, starting to make them on the 4th, but they're available on the 10th because we're booked through the 9th. And I imagine both healthcare systems are in the same spot, being booked up, and with the events that we've planned, they've been focused on the initial part of Group 3. So we will move through the rest of Group 3 as fast as we can and do that in as organized a fashion as we can to make sure that that vaccine's available. But as Dr. Priest mentioned, we can't make it available if we don't have it.
Okay, and then just a quick follow-up for Dr. Little and Dr. Priest. If the governor comes out today and says Group 3 is open starting tomorrow, will Atrium and Novant start booking appointments for that tomorrow?
Yeah, if whatever group is eligible to book appointments through our scheduling platform, when they become eligible, we're booked out with appointments in our sort of standing sites into June, but we have pop-up events between now and the end of the month that we'll be holding, and anybody who's eligible from groups 1 through 3 will be able to schedule into those appointments when they become available.
Yeah, and I would say Novant's in agreement with that. And what we're doing is we're moving patients up as vaccine allotment increases. So patients that are currently scheduled in April and May, if we have more vaccine before them, we'll be moving them up, and we'll schedule what's in the appropriate group based on the governor's guidance.
I think the main point here is that it's a fluid process as we learn more about what vaccine is available. And I think all of us are working as hard as we can to get those folks who are eligible into slots so they can get vaccine. Our intent is to get the vaccine out as fast as we get it. That's what's going to benefit our community the most.
Next question is Damini Lewis, WSOC-TV.
Good morning, everyone. Thanks for having this news conference. Quick question, Gibby. You mentioned that the Johnson & Johnson vaccine will be about 11,000 plus. And can you specifically break down how it's going to be allocated between the healthcare systems and the county and the targeted group that this first round of J&J will be going to?
Well, there's again, a fluid situation here. We've worked with both healthcare systems. I think I'm not going to give you the numbers because I'll get them wrong. I don't have them in front of me, but there's an allotment going to both healthcare systems, and they have clinics set up that they will use that vaccine as quickly as possible. I think most of the vaccine, excuse me, at this point is focused on that initial part of Group 3 because that's where the state's focus has been up to this point. But again, if we have vaccine that's not being used for that group, we're going to use it for the rest of group 3. We're not going to let vaccine go to waste. So I think we have different events scheduled that do focus on teachers and childcare workers. Both hospital systems have those efforts scheduled as well. But again, vaccine's not going to go to waste if we don't have enough of those individuals to use this vaccine. We'll use it for the rest of group 3 or those who are still eligible in groups 1 and 2 and have not gotten vaccine at this point.